Before placing your infant into the tub, make sure you check the water with your wrist that is the closest to your baby's skin. Make sure that you do not place your baby alone on a couch or a chair. Avoid latex and balloons. Balloons are a choking hazard. Make sure to place all firearms in a safe. No co-sleeping with your infant. Make sure your smoke and carbon monoxide detectors have their batteries and are placed properly. If you have pets, make sure to introduce your baby slowly to them. Make sure to schedule all of your follow-up appointments. Everyone should have a 6-week postpartum follow-up. Your provider may want an earlier appointment, but keep your 6-week follow-up. Thank you for choosing Madison Health for your hospital needs.
Hello, congratulations on the birth of your baby. We're so excited for you and want to make sure that you feel as successful and confident as possible when you go home with your new baby. You'll need to schedule follow-up appointments with your baby's provider 2 days after discharge, and then again when baby is 2 weeks and 2 months, and then follow your doctor's advice for future appointments. This is a nasal bulb syringe that may be used to remove nasal blockages. You can use nasal saline, 1 or 2 drops in each nostril, followed by gentle suctioning. To use the bulb syringe, you will compress the bulb first and then put it into baby's nose and release. Once you're done suctioning the nose, clean the bulb syringe. Be careful not to do this more than once or twice per day because it can cause some swelling as well. Spitting up is a very common occurrence in the first year of life. Spitting up may have many causes such as overfeeding, swallowed air, poor burping, relaxed stomach muscles, and formula intolerance. Frequent burping and keeping the baby upright after feedings for about 30 minutes are simple and effective treatments for spitting up. Your baby's umbilical cord will turn from yellow to brown to black and will typically dry up and fall off around 10 to 14 days of age. To care for baby's umbilical cord, keep it dry by folding the diaper down off the cord. Only give sponge baths until the umbilical cord is healed. Notify your provider if the surrounding skin becomes red, swollen, or if a discharge develops. When changing your baby's diaper, make sure to clean any poop completely off baby. You may use a cream if a rash develops. Keep baby's diaper dry and wipe from front to back for girls. Also for girls, you may notice a bloody discharge in their vaginal area that may be present for the first month of life. This is caused by withdrawal from the maternal hormones. If you're planning on getting your baby boy circumcised, ask at the doctor's office for care instructions. For the first few weeks, just sponge bathe your baby until the cord dries up and falls off. Some areas of your baby's body require more frequent cleaning. Once a day, take a warm, damp washcloth to your baby's neck and hands. Milk can dribble down and become trapped in the neck creases and create irritation. For a tub bath, don't ever leave baby alone in a bath, even for a moment. Check the water temperature and make sure that it's warm but not hot before putting baby in. It's recommended to bathe only about 2 to 3 times per week and use only water or mild fragrance-free soaps. Frequently, baby will have dry, scaly skin that may peel off in the first few days. If the peeling is severe, moisturizing lotion may be used to speed up the process of healing, but the skin does not normally need oil, lotion, or powder. You may also notice a waxy, scaly substance on your baby's head. This is cradle cap, which is kind of like baby dandruff, and it may appear on your baby's scalp. While it is harmless, you can also use baby oil or a baby shampoo to soften the scales and then use a soft bristle brush to remove them. Baby's fingernails will harden in about 10 days and will be easier to file at that point. Until then, use mittens or socks to prevent baby scratching their face. It's also recommended to use a file and not clippers to prevent injury. Dress them in one more layer than what you are comfortable with wearing. For temperatures and signs and symptoms of illness, 97.7 to 100.3 is considered normal for babies. If their temperature is below or above that range, be sure to call your baby's provider. Under the armpit is the best place to take a baby's temperature. Serious reasons to call your doctor or take baby to the ER as soon as possible include difficulty breathing or bluish skin or lips. Encourage tummy time for babies while they're awake and parents are monitoring. Rotate their head from side to side to prevent the head from becoming flat. Let's talk about crying. Babies will cry every day for about the next 2 to 3 years. While this might sound scary, it's important to remember that babies cry to communicate. If your baby is fussy, make sure they're fed, warm, dry, and burped. Sometimes they need a change of environment, and just walking outside can help. Responding promptly to your baby's cries can help them feel secure. You cannot spoil a baby by comforting them. You can use the crying plan in your discharge packet, or it's helpful to run through the 5 S's of comforting a fussy baby: swaddling, shushing or white noise, swinging or rocking, sucking on a pacifier or on a parent's clean finger, and side or stomach sleeping can help soothe your baby. Stomach position is not safe for sleeping, but may have a calming effect if you're watching baby. If you've tried everything and your baby is still fussy, it's okay to put baby down in a safe place and walk away for a few minutes. Take some deep breaths or listen to some music and remind yourself that this will not last. We recommend immunizations. Check with your nurse and make sure that the hepatitis B vaccine is done if you've requested it. If you have any other questions about immunizations, ask your doctor. Jaundice occurs when bilirubin builds up in a baby's bloodstream. It is a common condition but can require treatment. It appears as yellowing of the skin or eyes. We check for this before you go home and then usually again at your first appointment in a few days. Good feedings and diapers are really important with jaundice. Bilirubin is excreted through stool, so keep an eye on the diapers out. Babies should have as many wet diapers as they are days old for the first week, and then about 6 to 8 wet diapers per day after that. Signs of worsening jaundice include lethargy, trouble feeding, and a high-pitched cry. If this happens, call your baby's provider. Safe sleep. Put your baby on their back to sleep. There should be no extra pillows or blankets in their bed with them. Baby should sleep in your room, but not in your bed. Separate bed, no co-sleeping in the same room as parents is recommended for 6 months. Baby's crib should have a firm mattress, and do not place baby on adult beds, soft mattresses, sofas, or cushions. Do not let your baby get too hot or overbundle your baby with clothes or blankets. Once your baby is taking the breast or bottle well, you can try giving your baby a pacifier that is not attached to a string for naps and bedtime. Do not smoke around your baby. It's also important to protect your baby from illness. The best way to protect your baby from illness is to wash your hands. Stay away from people who are sick. Don't take baby out in crowded places. Newborns have underdeveloped immune systems. Don't smoke near the baby. Secondhand smoke weakens the immune system. And make sure your baby stays up to date on vaccinations. Above all, enjoy your baby, and please don't hesitate to reach out to us or your baby's provider with any questions. Thank you for choosing Madison Health.
When you're ready to go home, we will have you bring up your car seat, and we will have you put your baby in the car seat. But before we put the baby in, if you loosen the straps, it's easier to get it around the baby's arms. There's a button here. You just press on that, pull on the straps, and that'll loosen it for you. Once you have your baby, you set the baby in the car seat. Put the straps around each arm. Okay, take the bottom buckle and just snap it into the bottom. Do it with both sides, and I can tell I need to loosen this a little bit more, so you can do that as you go if you need to. snap that in. Once you got those secured, snap your chest buckle. You'll want it up against the breastbone. To make it tight enough to check it, we'll do a pinch test. If you can pinch the straps, then that is too loose. Pull on the strap down here to tighten it. Try the pinch test again. I still can pinch it a little bit. You can also try a 2-finger if you want it snug on the fingers but not too tight. We still need to tighten it a little bit. So we'll pull that a little bit more. Kind of adjust the chest belt. Okay, so I'm not able to pinch any longer. We want to make sure that this is right over the breastplate. The strongest parts of the baby are on the collarbone to the armpit, and then also their hip bones. So we want to make sure that it's tight in both places there. We don't want the buckle where it's on the belly, because that's soft tissue and that will injure your child if you were to get in an accident. So make sure it's up here on the hardest part of their body. And then once we check that and we're good to go, then you guys have a great day and enjoy your baby.